single month you are worried about your period pains, and again you're wondering what causes period pains. Yeah, period pains is normal and common part of your menstrual life. But again, period pains can be an indication that there is something wrong within your body. What kind of pain is normal and which one is not? When should you be worried about having period pains? What are the signs and symptoms of this kind of pain that should really worry you for you to go and seek medical attention? And lastly, what causes period pains? Welcome to the Nursing Moms. I'm Nurse Janet and I do videos much on reproductive health. If you're interested in any kind of these videos, kindly hit the subscription button so that we can move together. The severity of period pains varies from woman to woman, and you realize some women experiences severe pain while others experiences nothing at all. I mean, they just go about their business with no pain, like nothing is happening to them. Lucky are they, because most women actually experiences some mild to moderate pains. What happens or what brings on the period pains? In every single month, every woman gets a chance to be a mother. Every cycle, your egg is released from either each of the ovaries. So what happens or how do period pains come? After release of an egg, your body prepares in readiness for the fertilized egg, and your uterus plays a very major role in this preparation. Just like a bird preparing the nest for the newborn, it has to lay feathers, and that is actually what happens in the uterus too. The uterus will make itself thick and spongy in readiness for an implantation, that is the attachment of a fertilized egg. Suppose there is no fertilization that took place, maybe you are using a contraceptive or you are abstaining and so there was no sexual intercourse. Then what will happen to this already thickened and prepared wall? It has to be shed off for the normal cycle to continue. The shedding off is what we call menstruation, because it was whatever we'll be losing, which includes some blood and mucus and other tissues, dead tissues from it. So like the uterus, how it will be losing this is in a form of contraction and squeezing. This is what brings about the period pains. In every squeeze, it will be trying to squeeze out this through the cervix, which is relatively small compared to the size of the uterus. Every squeeze is painful, and again, there is a hormone involved in this, that is hormone prostaglandin, which will help to aid the uterus muscles to contract and squeeze out this blood, which we call menstruation. This is where the period pain comes from, because it's like it's trying to squeeze something and there is contraction. Every squeeze, it will be painful. If the level of prostaglandin hormone is high in your blood, this is the hormone that triggers the uterine muscles to contract, then you will have severe period pains. This is what brings about the period pain. The 6 symptoms that will tell you this kind of cramping is not normal and there is some condition underlying. What are these things, or when should you be worried? The first sign that you should be worried about your cramps is when your cramps interferes with your daily life. If you cannot go to work just because of cramp, then it's not okay. If you cannot take care of yourself or do your the daily activity cause, just because you are cramping, you are in bed throughout, you cannot get out of bed because of cramp, then there is some underlying cause. You really need to go and seek medical attention. The second one is if your cramp is not relieved by analgesics. Actually, cramping pain can be released by some injectable or even oral analgesics, and we also have the muscle relaxant drugs that can help counteract the effect of those muscle contractions. If you realize even after taking these kind of drugs, you are not helped or you are not relieved from that severe cramping pain, then it shows there is something that is not okay. The third symptom is if your menstrual cramps last too long. Ideally, most of the cramping pains last between 24 to 48 hours after the onset of your periods. But again, if you realize that you are bleeding for 5 days and you have this cramping pain throughout your 5 days of bleeding, or even some extend post-bleeding days, then this is not okay. You really need to go and seek medical advice. Another good reason why you should seek medical advice from your doctor about your cramping history is when your cramp doesn't feel normal. Actually, you are bleeding heavy and in clots, and the cramps are so severe, or it doesn't feel like the normal cramping. It's accompanied by your general illness and back pain and everything is not, you just feel that this is not okay. And more so when the bleeding is much in clots. This can be an indication of something different, and actually as soon as you can, go and seek medical attention. If your cramps is also accompanied by random pelvic pain, actually you're feeling that dull pelvic pain, it's aching just because you are cramping. Every time you are cramping, you realize that you have that dull, aching pelvic pain. It can be a sign of either endometriosis or even fibroids. You really need to go and seek medical attention for that. And lastly, you should also seek medical attention if your cramping is accompanied by the following: nausea, vomiting, and diarrhea. If you have fevers alongside your cramping, if you have spotting or heavy bleeding alongside your cramping, if you have pain during or after sexual intercourse alongside your cramping, these are not healthy signs, and you should really consider going to see a gynecologist for these kind of reasons. Thank you for watching. Let's meet in my next video. I'll be sharing what causes pain during sexual intercourse. Bye.